Hey guys, this is Dr. Wu at Cosmetic Laser Dermatology. Today we'll talk about what is laser resurfacing. And now, laser resurfacing is a fairly advanced technique that we use to basically use lasers to peel away the surface layers of the skin in order to stimulate a very powerful healing and collagen response that then totally rejuvenates everything that we've treated. So it's one of the best ways to really turn back the clock and rejuvenate our skin. So the perfect candidate for laser resurfacing is generally someone who has more advanced signs of photoaging and photodamage. And skin type also plays a major role, whereas sort of fairer types of skin tend to respond a little bit safer and a little bit better to the more aggressive types of lasers that we use. In the most aggressive forms of laser resurfacing, where we use so-called ablative lasers, these include CO2 lasers, erbium YAG lasers, the downtime after the procedure can be fairly significant. We're talking about a week to 2 weeks of healing time. But afterwards, the skin can be a little bit pink or a little bit red for a few weeks and then slowly blend away. In total, I usually counsel patients after that kind of a procedure that there will be 2 weeks of healing time and then another 2 to 4 weeks of sort of mild redness as it slowly fades back to normal. Aftercare for laser resurfacing is actually very important, and we follow actually a very strict sort of regimen of a variety of healing creams and ointments, as well as soaks sometimes, and skincare, cleansing, etc. This here is what we call an erbium YAG laser. It's one of the laser resurfacing devices that we use, and as with most devices, it's actually adjustable. So, for example, at certain levels, we can achieve that effect, and if we change it up a little bit, then it's a little bit more intense, and you see here, this is kind of how we resurface the skin. Another one of these devices is called the CO2 laser, and this one can also be adjustable and so you can see how the pattern that it provides is a very even pattern, but it leaves parts of the skin untouched. This is what we call fractionation, so that it enables better healing and a better result.